My name is Reuven Shanik. I'm a pediatrician in Lakewood, and unfortunately this year we're seeing a much larger outbreak of influenza, as compared to any other year since I've been in practice. The flu outbreak this year started a little bit early. It started about a month ago, where usually it doesn't start until mid-January and peaks end of January and February. This year we're seeing probably starting early December, we started to see cases of flu, and it's quite rampant in our community. We've seen over 1,000 cases of flu just in our practice alone. Last year we saw maybe 100 cases in our practice the whole winter. About a few years ago we did see an increase in the number of flu, but never so many cases. Fortunately, the flu this year it seems to be a milder strain. It usually lasts about 4 or 5 days. Some children, after 2-3 days, the symptoms seem to diminish and really go away. All children are high risk, all elderly are high risk, so we recommend the flu vaccine for all children anywhere between 6 months and up. Patients on chemotherapy or immune problems or chronic illnesses like diabetes, kidney problems, thyroid problems are much more high risk, and it's much more dangerous for them. And certainly newborns, and that's why in pregnant women, that's why we're recommending so much that the flu vaccine be given. The flu vaccine is usually given in 2 doses between 6 months and 9 years of age if you haven't received in the last 2 years, and 1 dose starting at 9 years of age and up. We're really having a good response to the fact that demand is so great. The state is running out of flu vaccines at points, and there's some times where in the office we really have no more flu vaccine, but we're trying to get it in as fast as possible, as fast as we can get it from the distributor. People feel that they do not want to get the flu vaccine. They think it may make things worse. On the contrary, it's not 100% successful. It maybe has an 80%, after 1 dose, maybe a 80% success rate. After 2 doses, maybe 85 to 90%. I shouldn't say success rate, but in preventing the flu. Last year, they felt that they realized the flu vaccine was not exactly protective for the strains they saw last year, but this year, on the strains they've seen, it seems to be much more effective. This year we're seeing a good number of influenza A and influenza B, and a couple of other strains it's protecting. So we're recommending for all children, all patients. How can we prevent the flu besides giving the flu shot? Proper hand washing, proper bedtime, proper diet. Children should be encouraged to zip up their coats and wash their hands very, very often. We hope that this outbreak is not going to last too long. It's quite taxing on the population and the office. We find that it's sometimes hard to keep up with the flow because the outbreak is really quite extensive this year. Probably more flu cases in this practice than we've ever seen in the last 35 years. But since it's a milder case, we're at least happy about that. We really encourage the flu vaccine, proper hand washing, proper hygiene. It's extremely important.